You know that feeling, that dull ache, that sharp throb, the one that makes you ask yourself, why do I have a headache? Well, it's one of the most common medical mysteries we all face. So today, we're going to play detective, decode the clues your body is sending you, and finally get some answers. And if you've ever typed that exact question into a search engine, you're not alone. It's a universal thing, right? That frustrating, sometimes totally debilitating pain that just stops you in your tracks. And you're left wondering, what on earth is causing this, and how do I make it stop? And when I say you're not alone, I mean it. Check out this number. Nearly 50 million Americans suffer from chronic or recurring headaches. That's a massive number, making it one of the most widespread medical complaints in the entire country. Now, here's the trap most of us fall into. Our first instinct? Grab a painkiller. And that's fine, but we're just treating the symptom, the pain. We're not actually solving the mystery of what's causing it. And that creates this frustrating cycle where the headache just keeps coming back because the real culprit is still out there. So here's the first big clue in our investigation. A headache isn't just one thing. It's a huge category with over 150 different types. This is where you get to be the detective. Your symptoms, like where it hurts, what the pain feels like, and what else is going on, those are all the clues that are going to help us crack this case. All right, let's start our investigation with the usual suspects. These are the common, everyday triggers that are behind the vast majority of headaches. And our prime suspect, by a long shot, is the tension headache. I mean, look at this chart. A whopping 75%, that's 3 out of every 4 headaches, are tension headaches. So odds are, when you've got a headache, this is what you're dealing with. So what brings them on? Well, it's all about muscle tension in your neck, your shoulders, and your scalp. It's not really a throbbing pain. It feels more like a tight, pressing band wrapped around your head. And the triggers? They're basically the greatest hits of modern life. Stress, hunching over a laptop all day, clenching your jaw, even just sleeping funny. Okay, culprit number 2 is so simple. You're just not drinking enough water. Get this, your brain is mostly water. So when you're dehydrated, your brain tissue literally shrinks a little bit, pulling away from your skull. And just that tiny contraction is enough to set off pain receptors and give you that dull headache. Now let's talk about caffeine. It's a real double-edged sword. On one hand, it can be a cure. It actually constricts your blood vessels, which can relieve pain. That's why it's an ingredient in a lot of pain relievers. But, and this is a big but, if your body gets used to it, skipping your morning coffee can cause those same blood vessels to suddenly expand, triggering a really nasty withdrawal headache. And for all of us who stare at screens all day, this one's for you. Digital eye strain is a huge headache trigger, but the fix is super simple and crazy effective. It's the 20-20-20 rule. It gives your eye muscles a break and can stop that dull ache behind your eyes before it even starts. Okay, but what if it's not just about your daily habits? Sometimes a headache that just won't quit is actually a signal of something deeper, a more complex medical issue. Let's be clear, a migraine is not just a bad headache. It is a full-blown neurological disorder, and it affects 39 million Americans. The symptoms are unmistakable: intense, throbbing pain, usually on one side of the head, plus nausea and extreme sensitivity to light and sound. And there's a huge genetic link. If one of your parents gets them, you've got a 50-50 shot of getting them too. Now, brace yourself because this next fact might be the most surprising one of all. You know when people say, I have such a bad sinus headache? Well, research shows that a staggering 90% of the time, it's actually a migraine in disguise. It is one of the most common ways we misdiagnose ourselves. So how in the world do you tell the difference? Well, a true sinus headache is actually pretty rare. The key is that it almost always comes with other very specific symptoms. You'll have nasal congestion, pressure in your face that gets way worse when you bend over, and sometimes even a fever. This is another really critical point. A lot of people have high blood pressure, but a headache is not a normal symptom. If you get a headache from high blood pressure, it means your levels are dangerously high. It's a sign of something called a hypertensive crisis, and that is a medical emergency. And that brings us to our most important section. Look, most headaches are harmless, but some are serious red flags for a medical emergency, and you absolutely need to know what they are. Okay, red flag number 1. If you ever experience a sudden explosive headache that you would describe as the worst headache of your life, that is an emergency. It's sometimes called a thunderclap headache, and it could be a sign of a brain aneurysm. Don't wait. Red flag number 2. A headache that comes along with a fever and a stiff neck. That specific combination is a major warning sign for meningitis, which is another condition that needs immediate medical care. And finally, red flag number 3. If a headache is paired with any kind of neurological symptom, we're talking confusion, weakness on one side of your body, trouble speaking or losing your vision, it could be a sign of a stroke. Again, do not wait. Get help immediately. All right, we've covered the culprits and the serious red flags. So let's pivot to what you can actually do about it. This is your personal action plan to solve your own headache case. Think of this as your go-to cheat sheet. It lays out a clear first response plan based on whatever headache you've identified. So for that tension headache, try some ibuprofen, a good neck stretch, and maybe a heat pack. If it's dehydration, simple. Drink a couple big glasses of water and rest. This is all about turning that diagnosis into direct, effective action. But the most powerful tool you have is becoming a detective of your own body. Start tracking your headaches. Just a simple log. When does it happen? Where does it hurt? What were you doing right before? It can reveal patterns you never would have noticed. This is how you turn a vague, annoying problem into a mystery you can actually solve. So at the end of the day, remember this: a headache is rarely random. It's a signal. It's a message your body is sending you, asking you to pay attention to something. Whether that's stress, not drinking enough water, or something more serious. Your head is trying to tell you something. The real key to feeling better is just learning how to listen.